Hi everyone, welcome back. My name is Dr. Tsai and I'm a board certified plastic surgeon in Beverly Hills, California. Today I want to talk about the two major issues that can come with breast implants. The number one is called breast implant illness, and number two is breast implant illness associated large cell lymphoma, or BIA-ALCL. The best way to describe breast implant illness is that the body is basically fighting itself, almost like an autoimmune disease. Because the implant is a foreign material, your body is basically reacting and fighting against it, causing these autoimmune issues, and your body basically fighting itself. So what are the symptoms? There's a list and host of symptoms, but the major symptoms are hair loss, headache, dry eyes and blurred vision, memory and concentration problems, chest pains, breathing problems, rashes and skin problems, gastrointestinal problems, joint and muscle pain, anxiety, chronic fatigue, depression, and possibly sleep disturbance. Although these are only the major symptoms that come with this, there are also a list of other symptoms that can happen with breast implant illness. So how do we diagnose this? It's very hard to diagnose because there's no test for this. And again, breast implant illness is not technically a diagnosis quite yet. It's still being studied and people are still researching and finding out not only the cause, but the issues and how our body reacts and why this occurs. There's no rhyme or reason or timeline of when this will start. Oftentimes there's a trigger that happens and then patients oftentimes feel some of these symptoms. For example, I've had a patient who this was triggered after pregnancy. I've had another patient that this was triggered 30 years later during menopause. There are also patients where there is no trigger and then one day they wake up, they don't feel great, and it persists and prolongs for years and years, and they don't know exactly what's going on. They get blood tests, scans, they go to their doctors, and nobody knows exactly what's going on. So again, nobody really understands what breast implant illness is. We're still doing some research about it, but it's basically a conglomerate of non-specific issues. How do we treat this? We treat this by removing the stimulus, which is the breast implants. So we have to not only remove the breast implants, but also the capsule or the scar tissue around the implant, because oftentimes there could be silicone particles within the capsule. Patients oftentimes ask, well, can I get another implant placed? Well, if you're having issues because of an implant, you don't want to put a brand new implant in. Unfortunately, you're going to have to live without breast implants. However, a secondary procedure that you can do is something called fat grafting, but that's only for a limited amount of patients because you will need excessive fat and extra fat in order to fill in the breast. So what does that involve? It involves liposuction of unwanted fat in any areas of your body, and that fat is then transferred to the breast. So there is a way to bring back the volume, but this is only limited to a certain subset of patients. So unfortunately, surgery is the only way to treat, fix, and diagnose breast implant illness, because once the implant and the capsules are gone and the patients feel better, then we know it's breast implant illness. Unfortunately, if we remove the implants and the capsule and the patient still has symptoms, then we have to send them to the doctor to further diagnose what else is going on. So the second major issue that I want to discuss today is something called BIA-ALCL, or spelled out breast implant associated anaplastic large cell lymphoma. So unfortunately, this is an immune cancer that attacks the T cells. This is also associated with textured breast implants, which is why I personally don't, and I think most plastic surgeons don't use textured implants anymore. In fact, one of the companies, Allergan, has fully voluntarily removed all textured implants from their stock. We can't even get them anymore. So unlike breast implant illness, this is a true diagnosis because you can actually test for it. The incidence here is 1 in 2,200 to 1 in 86,000. There's a very huge gap here because, again, there's a lot being studied. A lot is not known about this particular diagnosis. So researchers are still trying to figure out what causes this and the treatment for this. So how do we figure this out? Patients start having symptoms of pain, swelling, tenderness, firmness, and they go and see the plastic surgeon and say, hey, my breast doesn't look or feel the same. Again, this also looks like many other symptoms such as capsular contracture. So it's important to go see your plastic surgeon if you feel like something is wrong with the breast or the implant itself. If your plastic surgeon is worried or feels like there's more testing that needs to be done, they'll send you for further testing to figure out if this is an issue for you. With BIA-ALCL, there's usually a late seroma, which means there's a fluid collection around the implant that happens years down the road. Your plastic surgeon would send you most likely to a radiologist to get this fluid removed and then it is tested to see if this is indeed BIA-ALCL. There's a certain marker called CD30 that's within that fluid that tells us if this is what the issue is. If you are diagnosed with BIA-ALCL, then you will require treatment. So how do we treat this? Basically, we have to go in, remove the implant, and remove the capsule, as well as all the fluid that's in there, and basically we cannot put an implant back in anymore. Usually, once the implant and the capsule and everything is removed, patients heal and they do fine. So it is important to continue to follow up with your plastic surgeon and to call your plastic surgeon if you feel like there's any issues with your breast or your breast implants. I hope this information helps. Comment below if you have any questions, like and subscribe, and follow us for more educational information.